Topic is Kaplan's line. Hello students, we'll discuss a topic. It's the initial step of a operative procedure. Just see, and it's MCQ question also for you. So find out what this marking is. See that there is a line here. There is a line here. It's coming. One is coming like this. One is coming like this here, and see that. So what is this marking is? See that it's incision along the west space between the middle and ring finger. See that middle finger is there, ring finger is there, ring finger, middle finger, and this is the line is called as Kaplan's line. Line drawn on the medial surface of the abducted thumb joining up to the hook of the helmet here, like this. Here, this is called as Kaplan's line, and this is important where this interaction in the this crease line interact with that. Just lateral to that, you have to put a incision to do the release of the carpal tunnel, to cut the flexor retinaculum. For carpal tunnel syndrome, it's a compression neuropathy of the median nerve because carpal tunnel is between the flexor retinaculum and the carpal bones in the wrist in front. It contains mainly median nerve and flexor tendon sheath. Ulnar nerve is outside the carpal tunnel, not inside. So whatever compression occurs the median nerve palsy, here thin arch, wasting of the thin arch, tingling numbness of the lateral aspect of the hand. So this is very typical presentation. Sometimes mainly it is common in women and myxedema, acromegaly, pregnancy, then carpal fractures, lunate dislocation, old Colles fracture. Anything compresses this space, compresses over the median nerve, causing neuropraxia and all these problems. Mainly in female, they can't hold the cup properly, and suddenly numbness occurs. They drop the cup. It's very typical feature. Many times the bilateral, typical feature of the carpal tunnel syndrome. Cervical spondylosis is the differential diagnosis. Nerve condition study, MRI, neck, and electromyography, different things. It gives a very clear-cut clinical diagnosis, final diagnosis of the carpal tunnel syndrome. Clinically, you can always suspect with the typical features of the low median nerve palsy as a neuropraxia. That is what exactly meaning of Kaplan line. It is my MCQ question actually. Remember, so this is the marking for incision to release carpal tunnel syndrome. And so what is safeguarded? The palmar cutaneous nerve branch of the median nerve should be safeguarded. Entire thickness and length of the flexor retinaculum should be cut, and now thick nerve should be safeguarded using the McDonald retractor, and skin is retracted using the special retractor like mustard retractor. And important entire length and thickness of the flexor should be cut, and two nerves should be safeguarded. This is also very, very important. So McDonald retractor helps in that actually, and your skin incision should not cross the creased line. And Kaplan line is a marking which is important to make the initial skin incision. And tourniquet should be used. It can be done under GA or brachial block or local anesthesia depending on the patient's acceptance as such. So that is the exact meaning. Carpal tunnel syndrome, Kaplan's line, and release of the carpal tunnel. How to do that? That is a very typical. This one. Read my manual of surgery for this detail about the carpal tunnel syndrome. And again, I request students, please subscribe my YouTube channel, and which for daily lectures, and like it and share with your friends and colleagues. Daily brief lectures will be there for upgrade your surgical knowledge. Interestingly, 5 to 10 minutes maximum. It will help if you can spend time and learn surgery daily on day-to-day basis, and also at regular intervals, once in a week or 2 weeks. Live sessions for 1.5 hours is there, where students will present, and with interactive sessions. Other than me, other professors will be there, so that we'll have a live session about how to present a case, how to discuss analysis, how to manage a case, how to treat a patient. So that will be very, very useful. And also, if you join this live session and get a certificate, it will be very, very useful for your future career. Student, answer the MCQ. Sentence classification you should in ABCD. Put the right answer in the comment box. I will acknowledge your answer. I'll put the answer later. Erbduchen paralysis is again ABCD. Put the right answer again in the comment box. I acknowledge you and put the answer later. So, quotation of the day: to get ideas, you should read failure stories. Success stories only will pass the message, oh, he is successful. But failure stories will help you to how to overcome failure to become successful. That is most difficult thing. That's very crucial. So read, understand failure story. Read failure story, you will become better to successful and succeed in your whatever profession or thinking process as such. It's a very good quotation as such. Again, students, I request you to subscribe my YouTube channel, share with your colleagues, and daily go through my YouTube channel. And also live sessions whenever it is there. Please join live session for your better knowledge about different interactive surgical subjects as such. So students, I hope you have understood this lecture very well. Thank you so much.